BioBalance Healthcast, episode 118, What Doctors Need from Their Patients.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
Today, we're going to talk about something that should help you navigate your conversations with your doctor a little better. Now, we've talked about conversations in terms of going to the doctor and how to go to the doctor and bring your information to them and get what you want to out of the visit. But now I'm going to talk to you about the changing times in doctors' offices that has to do with phone calls and email communications between doctors and their nurse practitioners or nurses and the patient. So what we're coming up against is a very rapidly changing environment. So you should know what is to be expected from a doctor's office. Mm-hmm. The environment is most doctors who take care of patients in the office don't take care of patients in the hospital. So they don't take emergency phone calls, like internal medicine doctors and family doctors.
So separate out, you have what are called hospitalists.
Hospitalists, they take care of you when you get to the hospital, when you have some really critical problem. Mm-hmm. And then you have the internal medicine doctors that take care of you for your office problems. And they see you in the office, but they are not going to be the one that sees you in the hospital. So basically, the new age of medicine is on their recorder at night or when their phone is busy is if you have an emergency, then proceed to calling an ambulance or the emergency room. They do not talk to you about your emergency. That just delays you in getting to the emergency room. And that's also a legal issue because if there's a delay in responding to you, and these are the doctors that aren't going to be taking care of you in the hospital either, then there's really no reason to communicate with them if you know you have an emergency. You should just go. It's just a delay. So you shouldn't wait at the house or wait to call the ambulance if you know it's an emergency. Mm-hmm. The doctor in his office or her office is not going to be of any help.
Well, yeah, if you're fixing dinner and you stick your hand in the silverware drawer and you slice your palm open and you're bleeding copiously, you don't need to stop and call your general practitioner and say, I cut my hand and it's really bleeding and what should I do? You go to the emergency room, you go to what we call a doc in the box.
Yeah.
One of these urgent care stops.
They can't stitch it and clean it and look at the nerves and look at the muscles over the phone. Maybe someday, but not now.
Well, and a lot of doctors won't do that in their office anymore. They don't do those procedures that they once did in their office because of all the liability issues.
That's true.
That are encumbered in that.
Well, hand surgery is a very, very, very specialized surgery. So if you do something to your hand, you should have it looked at by an emergency room doctor or a hand surgeon. Now, hand surgeons aren't going to be ready to do a 5-hour surgery on you in their office. So you probably, if you have some major problem with your hand, go to the ER and have it evaluated.
Most people my age grew up in a different world.
I know, that's why
we're having this conversation, because I remember as a younger adult with children, calling the exchange and waiting for the doctor to call back to say my son has a fever or he's been vomiting or he's complaining of nausea. He says his stomach hurts. What should I do? And they would ask me a whole lot of questions, and then they would say, treat him this way, or they'd say take him to the emergency room, have him evaluated for appendicitis. And now,
or they'd say come into the office.
Yeah, or they should bring these things, it's amazing, the circadian rhythms of human beings, when you feel better, when you feel worse. This stuff always seems to happen like at midnight, 2 a.m.
It does. And I also took call. I took call by phone.
Well, but you're delivering babies too, though.
Well, no, and I was like, we'd have to tell people, if you break your water or you're in labor, don't stop and call me and wait, because the minute you get to the hospital, they're going to call me. Right. So there's nothing that I'm going to tell you that I haven't told you in the book I gave you and the website instructions and the handouts. There's nothing I'm going to tell you any different than having you wake me up twice.
I'm not going to come get you and take you to the hospital.
Right. So that still didn't necessarily go through and really happen because people panicked. But there's no good reason to, unless your doctor says, call me so I can head to the hospital because they think you're going to have a fast delivery. But that was one of the things that really made no sense to me. But in those days, I took call like every third night. Okay, so that meant I was at the hospital. I was doing 36 hours without sleep, which meant I was really tired. And if I did get to go to sleep, I really wanted to sleep. So often in those days, it was common for people to call me up and say, I can't sleep in the middle of the night. And I'm like, or call me up to have somebody to talk to.
And you're like, I'm sorry, call someone that cares.
And no, I didn't say that, but that was considered acceptable. That's no longer acceptable.
Yeah.
That wasn't really acceptable then.
And unless they know you personally, they're not going to get to you. I mean, to have your personal phone number.
They used to.
But
for 29 years they got me.
Yeah.
And so now I don't have an emergency practice. That's not what I do. But in those days, that's what people did. Mm-hmm. And it was considered okay. Mm-hmm. But I have to tell you, if you do that to a doctor now and call them up and wake them up when they've been up half the night and say, I can't sleep, then I have to say that doctor's going to be not very happy with you.
Yeah.
And that's not the best care. And it is kind of rude. I also was one of the very few female doctors when I started, first 10 years of practice. So I'd have lots of women call me about things that weren't things I was dealing with, like anxiety or a urinary tract infection they'd seen their other doctor, their family doctor, or their primary doctor for. And they'd call me and they'd say, I need to have blank, 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 and it's 3 o'clock in the morning, and so I'm on the phone. And they said, I didn't want to wake up my other doctor. He's sleeping.
Yes.
And I'd be like, holy moly, am I chopped liver because I'm female? So you're going to call me and wake me up, but you're not going to wake up your primary doctor, who would then call in your prescription. So there's some etiquette to making phone calls to the doctor, and being lonely and having somebody to talk to is not a good reason. In fact, it's all these really non-important calls or non-emergent calls are reasons, I know you're going, yeah, you're griping, and I am kind of, but it's why doctors don't take calls anymore. Well, doctors don't find it to be helpful or medical to take those calls.
And liability issues, too.
Yeah.
Especially since they're not going to be the ones treating you if you go to the emergency room or to the hospital. But part of why we're having the conversation is the technology and the culture has changed. And so you can't get through to a doctor because the exchange closes at night. And they say, what you get if you call the numbers, they say, if this is an emergency, go to the hospital. If it's not an emergency, call during office hours, which are X to Y. A lot of times you discover at 7 o'clock at night that your prescription needs to be refilled. 20 years ago, 15 years ago, you call your doctor, they'd phone something in, you go up to, if you had an all-night drugstore, you could go. Now you call and they say, call our prescription nurse tomorrow morning when the office opens. The message automatically says that. And anytime you ever call a doctor's office, you're going to hear two messages, night or day. They're going to say, please listen carefully because our options have changed. And then they're going to run through 20 options. And you get ticked off about that because you got something in your mind. Your kid is bleeding, or he's throwing up, or you are sick, or you are dizzy. And you want to say, is this related to what we've been doing and what you've been treating me for? Should I come in? Do I need to go to the hospital? Somebody help me here. And you got to patiently go through all the options. And you get frustrated by that. Or they're going to say, if this is a true medical emergency, go immediately to the emergency room.
That's true, because you can't really do an emergency in the office.
Right.
So one of the things you can do to help yourself out is when you're calling the doctor's office, think to yourself, is this an emergency? I mean, if it's at night, if it's during the day, ask yourself, what do I really want to know?
Right.
What's my symptom, and what question or questions do I want answered? If it helps, write them down. I can't tell you how much time I spend having people go, just kind of thinking, or my nurse practitioners do. They just wait for the patient to gather her thoughts or his thoughts. Write them down, because this is a time-sensitive deal. There's lots of phone calls to return or emails to return. And so it's not something where we're just sitting around talking on the phone all night. That's
again,
not
the way the delivery of medicine has changed. Your office doesn't deal with insurance directly, so it's not the same issue for you. But general practitioners, because of their contracts with insurance, have to do such a volume of visits that they may have 30 people that they see in a half hour. They don't have time to...
They may have
They have them all in the office anyway.
They may
waiting,
see
lined up.
one person every 10 minutes.
Yeah.
I mean, and that's pretty quick. So, I mean, that's a very fast visit. This goes for both phone visits, email visits, or office visit. It's if you think about it, you've got like 5 minutes and 3 points to make, because then they've got to spend the rest of the time telling you what you should do.
What the responses are.
And if you don't get a directive, like, you give them the problem and you tell them what's bothering you, and then they just start talking and then they leave the room, you have the right to say, wait a second, tell me what to do. What is your advice?
So in an email or a phone call, you want to do the same thing. For instance, if you're going to call your doctor because you want a prescription or you think you might need a prescription, you've had a preliminary visit with the doctor, it doesn't end up requiring a visit, but the doctor's going to say, I think I will call something in for you. What's your pharmacy's phone number?
Yeah.
And then you have to go, oh, wait, that's downstairs in my address book. And you get up and get out of bed and stumble downstairs and look for the address book.
And we don't know which one is yours.
So
we can't just go, oh, a pharmacy.
Before you call the doctor,
we have to know your pharmacy.
Get that number. Have it sitting in front of you. Think ahead to plan this conversation to make it efficient and effective for you. So ask yourself, why am I calling? What do I want to know? What am I afraid of? What am I experiencing? Write those questions down, because when you speak to the doctor, if you're sick, if you're upset, if you're not feeling well, if you're distracted, it's really hard to have an efficiently helpful phone call. So if you can prepare this before you call, then the doctor gets on the phone and you hit them, or the nurse, you hit them with the 3 things that you need to know. My fever spiked, I've thrown up 3 times, I'm having diarrhea, what should I do? And there may be some thing that they'll tell you to do at home. They may tell you to go to the emergency room. They may say, you know what, come in, I can get you in this afternoon, or I'll come in tomorrow morning.
And there are some things you just can't do over the phone. In fact, there's a lot of things you can't do over the phone effectively. You kind of have to look at the patient or look at what lesion or what problem they have. I mean, oftentimes just looking at the patient helps you know how sick they are, what their blood pressure is, what their pulse is. The whiteness of their face, or if they're dehydrated.
Their fingernails. How often do you look at their fingernails for symptoms?
All the time.
Yeah.
But picking up their skin, and if it stays tented, they're dehydrated. There's all kinds of things we do that you don't even know we're doing when we're looking at you, And I mean, yellow eyes, or, a huge goiter or a mass in your neck. You may not see it, but we see it. So there's a lot of things that we have to look at that give us information so that we can treat you appropriately. And we want to treat you appropriately. We don't want to miss something. That's not our goal. Our goal is to actually treat you and get the right diagnosis and give you the right answer and get you well. Nobody becomes a doctor so that they can just tool people around. That's a common thought, but we don't. I mean, it's really a matter of how tired are we when we answer the phone? I know that I was always nicer on Friday night of a weekend call than I was on Sunday night after I'd answered 40 or 50 phone calls. So it's a matter of how long have I been on call and how stressed am I. The doctor may be short with you. It doesn't mean they don't necessarily like you. It means they're tired and they've had no fun for 3 days. They've just been working. So, it's a little different than you might think. Call is not, oh, I'm going to sit here and stay up all night and wait for the phone to ring. That's not what call is. Call is,
you're getting on with your life.
I'm trying to do my life and answer phone calls and try to help people at the same time. And, I mean, that's what I did when I was an OBGYN.
Right, you're wrapping Christmas presents. You're watching the baseball game. You're having dinner, and a call comes in, and you're on call, so you have to take it.
So you break, and you go talk to the patient, and you come back. But you may not still be in that mode of in the office, and no, I'm not just sitting there waiting for someone to call. Or email. Or email's made it a little easier to just get information to patients, and we use email. If patients have questions, they email my nurse practitioners.
Right.
Once again, sometimes it's really hard to read 3 or 4 paragraphs. I still don't know what they want.
Unfocused.
Yeah, just kind of
fill it all out.
They tell me everything they ate and did all day, but I don't know what the question is.
Right.
So it's very important to know what your question is and do it as succinctly as you can.
Right.
And then give supporting information so that whoever's answering this question and could give you the proper advice.
Yeah, don't worry about being rude. I mean, be succinct. Be
just
straightforward. This is the symptom I'm having. What should I do? It doesn't have to be a nice social paragraph. Thank you so much. I had enjoyed seeing you last Thursday. I hope you guys have a great Christmas. And by the way, I'm vomiting.
And it's not a diary either.
Yeah.
It's not like every single thing you did that day. I know some people blog like that, but that's not how you should talk to your doctor. You should just write down what's important that you think's important and what you want to know. I
was having a conversation the other night. A physician friend of mine turned me on to a new TV series, new to me, from BBC called Sherlock. And it's a modern version of Sherlock Holmes. Mm-hmm. So I was watching those things, and they're really addictive. But Sherlock Holmes in this film will periodically stop and deconstruct for the audience how he made his conclusions. Mm-hmm. Because in the flow of the show, it's like he instantaneously knows these things. And people are like, oh my God, how do you know that? How could that have been true? He has the information in his brain. And he can deconstruct his data flow process to articulate that. Mm-hmm. So my friend and I were talking, and it was kind of like what you just said, which is what made me bring this up. When a physician sees you and chats with you, they're receiving an influx of information on multiple channels based on their training, their knowledge base, and their experience. And so if you pinch their skin and it stays mm-hmm. tinted, what that means. You look at their eyes and the color or the fluidity or the paleness. I mean, you're assimilating all this data. Even I always shake their hands, not because, here, shake my hand. Not because I want to see if they have a firm handshake, but to see if they have sweaty palms, see if they have warm hands, if they have cold hands, if they've got terribly dry hands or slick, like scleroderma is really slick hands. I mean, we're feeling all that. I was talking to my wife the other day about arousal and something called galvanic skin resistance. And she's like, why do you do that? Are you trying one of those things again? Another one of your experiments. No, but she's probably going, what is he talking shakes her head and to Moppet about? Yeah, exactly. But the point is, doctors are assimilating all that stuff, and then they reach a conclusion. And if it's relevant, most of them can backtrack and deconstruct that and say to you, this is why I am thinking what I am thinking. And here is what I want you to do. Mm-hmm. One of the challenges when you don't call efficiently or email efficiently, and you don't ask that question, doctor, what do you want me to do? And why, if you're curious about one, maybe you don't even care. Just tell me what to do. Just tell me what to do. You don't necessarily get there, and you go away. And what does that mean? Say what that means. It means you go around and around and around, but you don't really get to the question. Yeah, with clarity. Right. Or specificity. And then we don't really know what you want. And so then a conversation for another day, maybe, is you do get there. You do tell them what you want them to do. And then they, for whatever wide range of reasons, are what we call non-compliant. People that don't do what the doctor tells them to do. Take this medicine until the prescription is finished. Don't take it till you feel better. They all tell you that. Most of us, and sociologists and anthropologists will tell you it's magical thinking. Yeah. We take half of the prescription and then we put it in the medicine cabinet. And if you go look in your medicine cabinet right now, there's prescriptions from 3 years ago that are out of date that were for something you're not sure about. I know that happens all the time. And you probably are just as likely to have eye medicine for the dog and ear medicine for the cat in with the prescriptions for grandma. And please don't mix them up. The stool softener for grandma. And you're looking at them like, what the hell are all these things supposed to do? But you won't get rid of them because magically they make you feel safer. Just because they're in there. Yeah. But just such as, okay, so here's the real kicker. Here's where what you really don't want to do. You really don't want to either call or email, say, and do what we told you to do, like tell them what the problem is, ask for their advice, they give you their advice, and then the next day call them and not have done anything they told you to do. Yes. If you don't do anything that your doctor just told you to do, don't call back. Especially if you talk to your next door neighbor and they told you. We're going to tell you the same thing. And then there's some people, I mean, if you're out there, if you listen to your hairdresser and take her advice easily and won't take your doctor's advice, there's a big problem. You might as well not call. I mean, if you're not going to do what your doctor advises you to do, then, I mean, granted, there are some things you go, oh, I'm not doing that. Well, tell them then. When you get that advice, say, well, I'm never doing that. Right. And do you have another idea? Like if I get a Medrol dose pack from somebody, I go, oh, can't do that. Give me some other idea. Right. Give me another answer because I can't do those. Those spin me out. So
So then they give me a different answer. But you have to tell them then, don't just go, okay.
And remember to remind them of what you know. If you know that you're allergic to Tylenol, because the doctor's got hundreds, maybe thousands of patients,
we may not
and they're
have your
giving you a
chart in front of
standard
us at night
response, and they're saying, oh, take Tylenol. You have to say, wait a minute, I can't take Tylenol. Give me something else.
Yeah, at night, we don't have your chart in front of us all the time.
Right.
We may be in bed answering your question and trying to remember everything about you, and that's not very efficient. And I still have paper charts.
Right.
So I don't have like online charts, which,
So
we don't know exactly all your history. You have to help us.
It does still happen that you need to call. It's going to be better for you and better for the physician to maximize the chance of success and improvement, the quality of your health and the way you're feeling, if you effectively and efficiently make a call and effectively and efficiently follow what the doctor tells you to do. Mm-hmm. So in the words of to bastardize a quotation from Winston Churchill, be brief, be factual, be gone. So, thank you for listening.
Thank you.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. Follow Dr. Maupin on Twitter at Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Brett Newcomb can be found at brettnewcomb.com.